Thank you. Well, Jan just set us up. She said it's boundless what we can do, but first we need the foundation to be able to do that. So we are here to talk about care, the care agenda, and the care economy. And I want to start just by defining it because that carries a lot in that word. And it really is the care economy, and care is the work, paid and unpaid, that keeps life moving. It's childcare, it's elder care, it's services for people with disabilities, and it's tending to each other that holds families and communities together. And it builds strong families, thriving communities, and resilient economies. But so often we all know that this is undervalued or invisible. It's no surprise that women, I think we can all relate to this, carry the majority of that burden. Statistics show that women spend 272 minutes per day doing unpaid care. Men spend 84 minutes. And that translates into 606 million women who are not employed or seeking employment, and 41 million men. And this isn't just about time, it's about opportunity, because those who are doing that are earning, they're building, and they're leading, and women have to step back. The research Nobel Prize winner from 2023, Claudia Golden, she researched how women's work has been counted and rewarded, and she said it's not about skill and education, it's about time and the expectations on care. When caregiving presents itself, women are the first to step back, they're the first to reduce hours, and they leave paid work. And this economic disparity is just not about talent. It is about a system that makes equality impossible. Until we truly value care and design jobs and expectations that reflect real lives, we will keep losing women in the workforce. We will lose their creativity, their time, and their leadership. And I know this personally. I started my company 18 years ago because I wanted to create a space where there was a flexible model, not just connect great people to great work, but also create space for women to work flexibly. And it really was about creating care space for the women on my team. But we also know that no single company, organization, or sector can close this gap. It will be about policies that make care affordable. It will be about workplaces that respect it, and it will be about a culture shift that shares it more equally. So I'm so excited to be joined with you all here, different leaders from different sectors who are helping to bring care out of the shadows and working to value more care and build stronger systems. And when we talk about care, oftentimes we're talking about compassion and generosity, but I want to talk about care as infrastructure here. The way that we have roads and bridges and digital networks that deliver goods and ideas, care delivers sustainable people, sustains people in the workforce. But it's chronically underfunded, undervalued, and it's more considered a private concern rather than a public good. But we're going to change that. We're going to talk about it as infrastructure, so let's explore that. Marilou, I want to start with you. 50 years ago, the women of Iceland left their jobs, they left their homes, and they brought this country to a halt, showing us what stepping back from caring by women can do. Can you share what happened that day and what it revealed as care as infrastructure?
Well, I'll start by acknowledging a radical activist feminist group within Icelandic society that styled themselves the Red Stockings, who connected up with other women that perhaps didn't identify as strongly with that courageous description. And from June until October 24th, women in this country, in farmhouse kitchens, in fishery processing plants, in banks, in telephone companies across the country talked to each other and started to really connect on the fact that everything at that point, all of their work, whether it was in the home, whether it was in the job market, was undervalued. And it was led, much of what happened was actually led by women from the home. And from June, when they had a Congress, to October 24th, 1975, they mobilized at the most local level. And that manifestation or feminization of what happened on the day off, because I think the other thing we can really learn from what happened in Iceland was they built a coalition. They didn't get hung up on differences, and they found a way, day off, that more women could buy into. I mean, of course, the Red Stockings and those who started it knew it was strike,
Right.
was a national strike. And what it did was it exposed the massive amount of unpaid work and underpaid work. And it woke everybody up, because 90% of the women in this country on October 24th, 1975 went on strike. They didn't care for their children. So as a result of that, there was a valuation, both monetary, but also it changed relationships. And it woke up the world. The headlines were across the world talking about how women had not only stopped Iceland in its tracks, but in many ways wakened the world and led to the feminization of many of the policies, including the whole concept of investment in care. And that's really the underpinning of what we see today.
Such an amazing example of care as infrastructure and an illustration of that. Lorinda, your experience as a business leader, as well as a single mother, you have a unique view on care and what it means for productivity and growth. What do you think needs to change in how businesses and investors define infrastructure so that care is seen equally essential to growth?
Thank you. I am a single mother by choice. I chose to have my daughter via IVF. And working in corporate America, I've been really fortunate to work at really large firms like JP Morgan Chase and Walmart, where I have felt truly supported throughout my career to take care of my family with my daughter. She's actually been sick for over 50% of her almost 4-year-old life. So we spent a significant amount of time at Children's Hospital of Philadelphia working with a number of specialists trying to figure out how to keep her happy and healthy. And what I'd say from an infrastructure perspective, there's 3 pieces. One, it's HR policies. So to what Marilou just described, what happened with the strike 50 years ago, we have equal parental leave in our firm. And so what that means is that partners from the very beginning, there's 4 months off for both of them, they at the very beginning realize what invisible work means with increased laundry, increased meal prep, sleepless nights, and all of those things that can actually help. I've mentored women who have said to me, I can't figure out how to balance it all. And I've said, well, have you thought about hiring a nanny or some other support? Like, I know your level in the firm. And they've said, well, my husband doesn't really like that idea. And so the point of like equal parental leave is an HR policy that can help there be appreciation for what level of effort and intentionality it goes into planning in that way. Secondly, I'd say it's employee resource group or business resource groups. So another example is at my firm, we have a working families network, so it's not just the women's network, it's a working families network that is equal participation for men and women. There's also a women's network, there's an elder care network, and so there's a lot of resources that can help people who are taking care of older loved ones figure out how do they get all the medical supplies that they need in their home. People who are taking care of young children, you can find resources to find the nanny support or the daycare. We have 40 days of backup care that are just $45 a day. And it's actually like income level adjusted on what the cost per day might be. So the firm has really spent time thinking about that from an HR and employee resource group feedback loop that is helping the company make sure they're meeting the needs of people. And then the third piece I say is coalitions. So I currently work for JP Morgan Chase. I previously mentioned I worked for Walmart. Think of organizations like the Business Roundtable that exist in America, where firms at that scale can sit and talk and learn from one another, and then think about the policies that can help with longer term employee retention. Like, not only has my career been able to continue to grow and evolve in the midst of dealing with some challenges in my personal life, but I have felt completely supported by my entire leadership team. And I think a lot of women step away when they deal with challenges like what I faced in the last few years because they don't have that infrastructure where they work.
Such great examples of tangible ways that companies are supporting care. And I'd like to turn to you because, Blessing, your work with Care Africa is really about bringing communities and different sectors together. Real sustained progress on care requires action from a diverse set of stakeholders, as you know. What would genuine cross-sector leadership on care look like?
Absolutely. Thank you so much for having me. And I don't know if you recall, but last year you and I were here on the same stage and we were talking about health. And then somehow, because I was on the panel, it segued into care. And I'm grateful that, care is taking center stage this year, because I think that is one of the things that I truly believe that we missed in the entire gender and feminist movement, is that, as you said, 50 years ago, we on these grounds, realized how, women took the day off. And that demonstration really, it demonstrated, right, the invisibility of care, how invisible care was. But I think what has happened 50 years from now is that we stopped there. Yeah. We did not move ahead to ensuring that care was valued and was seen as valuable, was seen as worth investing in. And I think that, for me, that is the unfinished business of the gender and the feminist movement, is care. I think it's how do we ensure that we can actually go back as women to quantify and value this care work. Because I still think that's the missing piece before we can even convince people that care requires investment, that care is infrastructure. Well, how big and how valuable is this care work? I think the second piece, when you talk about cross-sector, we've talked a lot about the need to redistribute and reward care work. And we know that when we talk about redistribution of care, we're talking about 4 different domains or 4 different sectors. We are talking about individuals, which are still primarily men because women are already doing all the care work. We're talking about institutions, markets, and the government. But when you look at all 4 domains, men are still the ones leading in those 4 domains. They are the ones leading in our government, in our institutions, at home. And so the question still, I think, leads us back to how do we ensure that men step into care? Mm-hmm. Because I don't think we're going to be able to solve that puzzle. And I think we heard that from the president yesterday when she basically encouraged us to rethink and reimagine, how we think and talk about gender and care. Because I think that we need to start thinking about how do we meaningfully engage, increase men's capacity to care in order for us to unlock care as an infrastructure. And I think the other piece too is, how do we move all of us, not just women, not institutions, markets, government, from this idea, right, of a capitalist economy to a caring economy. Mm-hmm. In fact, I almost want to move our conversation from seeing care as infrastructure to how do we move, this competitive and capitalist, environment into a more caring environment. Mm-hmm. Because I don't know about you all, but I am feeling this dark cloud over all of us since we last talked here last year around the authoritarian movement, when we saw who won, across, the border, the continent, over there in the Americas, we felt this dark wave. And I think we're still feeling that dark cloud. And I think the only way to get out of this dark cloud is to actually engage men meaningfully in the care conversation. We're seeing, an increase in loneliness, in climate crisis, rising population, shrinking workforces. There's this resistance to care, and it's affecting all of us. And so we need to think about care, not just as infrastructure, but how do we even shift the conversation to the need for a caring world?
Yes, that's beautiful. Thank you. Yes, let's clap for that. Let's have a caring world, for sure. And Lizzie, you've seen firsthand what right investments and how they can shape national development. What types of investments or policies have you seen supported or hope to see supported that would make care as a true infrastructure essential to economic growth and a caring economy? How do we create that?
Yes, of course. I'm going to take us sort of back to the ground, because I would like to talk about what care has meant to every sub-Saharan Africa country that has been impacted by HIV and AIDS. And I'm talking about care, not just the healthcare, because it is in that response that countries like mine mobilize a huge number of women to start providing care, to identify, to link people to healthcare, to then do the bedside care. I'm talking bathing, changing bandages, changing adult diapers. The government was providing all all the commodities needed, but it was thousands of women that made it possible that we can get where we were. In my country, we reached the 95 target in the middle of a COVID response. And it wasn't just because government is committed. Government is, of course, committed. We ring-fenced the money for ARVs. Everybody in my country can get ARVs free of charge. But it is the care in the community, in the home, that is done by swarms of volunteers, and most of those volunteers are women. Now, thank you. I am just wondering, had these volunteers been men, would we still be not paying them?
Right.
We started with a little stipend. This is less than $30 a month. We started with a little stipend, and it stayed the same for the past 20 years. And these women, these volunteers, continue to come and give care for their own families. They're raising families, they're looking after their elderly, they're looking after the extended family, and they are looking after the community in terms of care and in terms of caring for the sick, caring for the disabled. So I think that is where I think perhaps we need to take the conversation as to what is possible to happen. But there are this is infrastructure that was created by the Ministry of Health to make sure that they can reach as far as possible and they can reach everybody and leave no one behind, but is riding on the back of women volunteers in the country. And I think in most sub-Saharan African countries, that would be true. But there are other good things that have happened, again, in terms of infrastructure and investment. Healthcare for under 6 in my country and over 60 is free. So, women with young children who need to take them to, that is free. Primary school education, that's a major investment for any government. But coming out of the AIDS pandemic, we needed to do that. There were a lot of children that were left without parents, left with grandparents, or even with great-grandparents or with neighbors. So we needed to make sure that every child in the country can get to school. So we have free primary school education, and that's a major investment in terms of looking at infrastructure of care that takes the burden away from families, from women. I wish we had what you have, but it doesn't exist in my part of the world. And it sort of extended to secondary school, where we're more targeted to much more vulnerable children that need support through secondary school. So I'm just giving a few examples where infrastructure really works and it's intentional and there's some investment into it. During the COVID response, we had a completely different. Did I go off?
We're almost done. We only have 1 minute left.
Okay. All right. So I just wanted to say that we had a cash for work that, very poor families, women were out of their jobs from factories, textile industries, were being given cash on a monthly basis to survive. And this actually demonstrated just how much that money, that cash was circulating back into the local community, creating an economic vibrancy within those communities. Because my country, unlike many, during COVID, we actually saw a GDP growth of 7%. And that didn't happen by miracle. It is because there was an investment into the community, investment into the women that were looking after children, and that commitment from government. So I think those infrastructures can be created, but we need to find a way to make sure that we can reach everybody and make it work for women.
Absolutely. And when we only have 25 seconds, I need like 4 more hours. There's so much to say on the care agenda and how it does create the structural necessity, creates the ability for women to lead, for women to stay in the workforce. And then we do have to have these cultural shifts to be able to share it with men equally and make sure that the workplace supports that. My next question, if we had another 20 minutes, was to really talk about not only care as an infrastructure, but also care as an accelerator. And that it really is necessary for women to be able to go into positions to lead and stay in the workforce. So as we close, I'd like each of you to sort of say, what does that mean to you, care as an accelerator in addition to being infrastructure? And maybe I'll start with you.
I would say care is not just being nice. It actually fuels productivity and helps with employee retention. And so if firms and governments look at it that way, about enabling productivity, they'll think about how they can provide greater flexibility and just trust that your employees are trying to do the right thing.
Lizzie, care as an accelerator.
I'm going to take you in a completely different direction as well, because, with the more developed countries, with the demand for care for older people, for all that, we have a lot of diaspora leaving our countries to go and work with professionals who go work in other countries as care workers, but I am not there. I just want to say we need to start thinking from within our countries, how we enable that and how we can work across countries and across the globe and make sure that those people are protected and they are respected and they are protected by the labor laws of those countries. But what is more important that in unlocking the care economy and including the diaspora is by providing accessible, affordable, quality care services that are family friendly. And like paid maternity leave for. That would allow more women to enter the labor force and stay in the labor force. And I think it is that jump, that extra work that we need to do to make sure we get there.
Blessing.
Absolutely. I think for me, I would love to spotlight an interesting fact that I think most people from my country, Nigeria, are not aware of, which is that Nigeria is on track to be the third most populous country in the world by 2040, behind India and China. And so when we talk about care as an accelerator, we are thinking about care as a path to unlocking productivity, unlocking and catalyzing our economy. We are seeing, of course, that there is need to invest in childcare, in elder care services, to professionalize and formalize the care workforce, to ensure that care work is valued by men and women, to unlock time, not just for women, but also for men, so that men, we can actually restore their humanity and their capacity to care. And lastly, I think it's also, like I said, coming back to how do we ensure that care is reflected in our GDP, in national accounts, in board strategies, so that it's not a side strategy.
Right.
It is a political, economic, and social strategy that is imperative to our survival and growth as a continent.
And invested in, yes, Marilou.
Invisible work equals invisible women. Women without leverage in a society that is depriving the entire society of the additional investment that if there was payment to women for much of their unpaid work would infuse the economy.
Okay.
And the last thing I'm going to say is that it's really important to remember that when you think about human rights in this context, we need to remember human rights are close. They're in the small places, close to home. So this is not only an economic imperative, it's a human rights imperative.
Human right issue. And it creates strong families, thriving communities, and resilient economies. And we can all go with that. So thank you. We had so much more to say. We'll make 2 panels next year. All right. Thank you.